The most important part to be discussed here is obviously the muscular attachment. So we will discuss what important muscular attachments are there on the anterior surface, on the borders, and then on the posterior surface. So let's just start. You can see this is the anterior surface of the scapula. The acromion, this is the coracoid process, the suprascapular notch, the superior angle, and this is the angle, and this is the border. Okay, then you have the medial border, then you have the inferior angle right here, and then you have the lateral border right here in the glenoid cavity. Okay, so typically at the glenoid cavity, there's the origin of the coracobrachialis and the short head of the bicep. The coracobrachialis and the biceps, these are the muscles of the arm, the anterior compartment of the arm. So we know that the anterior compartment of the arm, it's a flexor compartment. So the muscles, the coracobrachialis and the biceps, they're responsible for the flexion movement of the arm. Okay, so the glenoid cavity is the site for the origin of the coracobrachialis and the short head of the bicep, which are actually the flexor muscles of the arm responsible for the flexion of the arm. Okay, then you have the part of the neck of this scapula, and at this little part of the neck there is origin of the long head of the subscapularis muscle. So the scapularis muscle is also important muscle of the upper part, and then you have this coracoid process, and at the upper border of the coracoid process you have the attachment of the pectoralis minor, which is a muscle of the shoulder girdle and a chest wall, and along with the pec major, pec minor is also responsible for somehow important movements at the shoulder joint. Then you have this depressed central subscapular fossa, and at this depressed subscapular fossa, there is origin of the muscle, which is the subscapularis muscle, and it's a part of the rotator cuff muscles, which is subscapular, supraspinatus, infraspinatus, and arteries minor, and they're responsible for the rotational movements at the shoulder joint. So anteriorly, on the anterior surface, on the glenoid cavity, you have the coracobrachialis and the short head of the bicep. At the neck, there is a long head of the subscapular muscle. Then you have got this fossa, which is the subscapular fossa located anteriorly, and this is the site for the origin of the subscapular muscle. Then you have the pectoralis minor muscle, which is inserting onto the coracoid process of the scapula. Okay, so this is the posterior. This is mostly the, somehow lateral part. So you can see this is the border. Okay, medial border. So you can see there is a insertion of the serratus anterior muscle. So the serratus anterior muscle is again supplied by the long thoracic nerve, and the serratus anterior muscle is, if there's a damage to the serratus anterior, when you're combing your hair, so this is actually the serratus anterior muscle, which is shrugging your shoulder along with that. So this is a combined action along with the trapezius. But there's injury to the long thoracic nerve, there's injury to the serratus anterior muscle, so the patient will have winging of the scapula. Then you have the trapezius, which is attaching to the spine of the scapula, just the superior surface of the spine of the scapula, right here. Okay. Then you have this supraspinous fossa, just above the spine of the scapula. And the muscle to be attached here, the origin of the supraspinatus muscle. Then you have the origin of the infraspinatus muscle from just below the infraspinous fossa, which is located below this spine of the scapula. Okay, so then you have this medial border. At the upper end of the medial border, there's attachment of another muscle, which is the supraspinatus muscle. So it's a part of some part there is at the just above the spine of the scapula. There's origin of the supraspinatus muscle, and it then attaches to the medial border of the scapula, which is the medial border and the medial angle, which is actually the insertion point for the supraspinatus muscle. Okay, so then you have another muscle which is attaching to the medial border. There's insertion of the levator scapulae muscle, and levator scapulae along with the rhomboids. They're also one of the important group of the muscle, which is the rotational muscles of the joint. And then you have the rhomboids, which are attaching to the scapula, somehow inferior lateral surfaces. And then you have the latissimus dorsi, which is attaching to the inferior angle. Latissimus dorsi is somehow related to the abduction of the arm, and it's the important muscle of the back. And somehow rotational muscle as well, somehow related to circumduction. And the rotational movements and the circumductions, they are a combination of the movements. And obviously, there is no one muscle responsible for rotational or circumduction movement. So it's a combined action performed by the different functions. And then you have the teres major muscle. It's also attaching to the lateral border of lateral and the inferior border of the scapula. And then you have the teres minor, which is attaching to the superior lateral part of the scapula. And then you have the deltoid, which is attaching to the somehow acromion process of the scapula. So that's how there are some muscles which are related to the attachment with the anterior surface, like we talk about the subscapular muscle, we talk about the teres muscle, we talk about the serratus anterior muscle, and then we talk also about the muscles which are attaching to the posterior surface, like which are attaching to the spine. We talk about the trapezius, the supraspinatus muscle, the infraspinatus muscle. Then their attachment of the levator scapulae muscle, latissimus dorsi, teres minor, teres major, deltoid, rhomboids. So they're all muscles which are attaching. And then I have already talked about the group of the muscles, right? We talk about the intrinsic muscles. We talk about the extrinsic muscles. We talk about rotator muscles. So the intrinsic muscles are the muscles of the rotator cuff, which are the supraspinatus muscle, infraspinatus muscle, subscapularis muscle, and teres minor muscle, and they're intrinsic muscles. Then you have the extrinsic muscles. We talk about the coracobrachialis, we talk about the bicep, we talk about the deltoid. They're responsible for the abduction and the flexion movements of the arm, and they're also attaching to the different parts of the scapula. So they're the extrinsic muscles. And then you have the rotational muscles, which are responsible for the rotational and circumduction movements of the arm at the shoulder joint. So they are rhomboids, rhomboid major and minor, and you have the teres major muscle, and you have latissimus dorsi, and then you have levator scapulae muscle. Why this becomes important to know the origin and insertion of the muscles? Obviously, because if you know what muscle is attaching to what bone, then you can predict or you can understand the mechanism involved in the movement of that particular joint or that particular bone. Like we talk about the clavicle, so we talk about the elevation, we talk about the protraction, retraction, depression. So we know that the clavicle has attachment with the trapezius, and clavicle is attaching the sternocleidomastoid. So there's a forward protrusion and backward retraction and elevation and depression. And then we also talk about the winging of the scapula. We talk about the extension movements, flexion movements, rotational movements at the shoulder joint. So that's how it's important to know the muscular attachment. Then the clinical entity is obviously the winging of the scapula. There's a damage to the long thoracic nerve, there's a damage to the serratus anterior muscle, and obviously then the patient will report to you with a winging of the scapula, because important serratus anterior muscle is attaching to that, and it's the muscular attachments of the muscular attachment to the bones. They're they are working, the muscles are working for the bones and the bones are working for the muscles, and they're providing a stability for the movement, and they're providing a protection. If there are a lot of muscles attaching to the scapula, that is the reason the scapula is being protected in most of the traumas. So whenever there is a fracture or injury to the scapula, then we will suspect that there was a severe chest trauma, maybe because of just a victim was being crushed over by the vehicle, there was a crash injury. So the mechanism would be severe in which the scapula would be injured, because there are a lot of the muscles which are attaching to it, they're protecting the scapula. So that's why the muscular attachments are very, very much important, and you need to understand them and you need to remember them so that you can understand the complex mechanisms involved in the movements of the joints and the movements of that particular bone.